So, today we are discussing a topic which is often kept in the shadows. We will be talking about painful sex, also known as dyspareunia. Now, medically, it is something which many women experience at some point in their lives, but very few feel comfortable talking about it or even seeking help for this. So, hello everyone, I'm Dr. Anjali Kumar. I once again bring greetings to you from Maitri. Maitri is a space where we talk anything and everything about women's health. So in this video, I will be explaining the causes of painful sex from physical to emotional factors, and we will also discuss the treatments which can help you find relief. So if this is something you or your loved one is going through, know that you're not alone and there are solutions which are available. So what is painful sex? So, medically, this is called as dyspareunia. Now, in medical terms, dyspareunia means persistent or recurrent pain which occurs just before, during, or after the intercourse. For some women, the pain is mild and occasional, but for others, it can be severe, long lasting, affecting their quality of life and intimate relationships. Now, this condition can happen at any point in their lives. It affects women of all ages. It's important to remember that painful sex is not normal, and it is not something which you should just live with. There are many underlying reasons, and understanding them is the first step towards finding the right treatment. So, first, let's talk about how common is the problem of painful sex. So, did you know that pain during sex is quite common, affecting 1 in 2 women at some point in their lives? And this number may be even low because many people do not seek help for painful sex because it's a sensitive topic. So, before we go further, let's first understand the types of painful sex. Now, the painful sex can manifest in different ways depending on the underlying cause. So, first could be superficial pain. Now, this type of pain occurs at the opening of the vagina or on the surface. Now, this often feels like burning, stinging, or a feeling of rawness. Women who experience superficial pain may notice discomfort as soon as the penetration begins, or even when attempting to insert tampons, menstrual cups, or even undergo gynecological exams. Now, this type of pain occurs due to tight hymen, infections, injuries, vaginal dryness, cuts, boils, blisters in that area, and vaginismus. Now, the second type of painful sex could be when there is deep pain inside. Now, the deep pain occurs during deeper penetration, and it is usually felt in the pelvis or in the lower abdomen. This feels like cramping, pressure, or a stabbing sensation. This kind of a pain is often linked to conditions which affect the internal reproductive organs like the uterus and the ovaries. So conditions like endometriosis, fibroids, ovarian cyst, and PID, which is the pelvic inflammatory disease, can cause this. So it is very important to distinguish between these two types because the treatment will depend upon where the pain is located. Painful sex can also be described as primary or secondary. Now, primary pain is the pain which you've had ever since you became sexually active, right from the first time. While the secondary pain develops after experiencing pain-free sex earlier, which means things were fine earlier and now suddenly the sex has become very painful. Did you also know that painful sex could happen because of physical and emotional factors both? So first, let's talk about the physical causes of painful sex. One of the most common causes of painful sex is vaginal dryness, which occurs when there isn't natural lubrication which is enough. Now, this can happen due to lesser time at foreplay, hormonal changes, especially during menopause, breastfeeding, or even after childbirth. This can also be linked to taking certain medications like antihistamines, antidepressants, and even birth control pills. Second is what is known as vulvodynia. Now, this is a little technical term. It refers to chronic pain or discomfort around the opening of the vagina or at the vulva. Now, the cause for vulvodynia isn't always clear, but it can cause burning, stinging, and throbbing pain during sex. And the pain may be constant or come and go, or it can even make even light touch or pressure very painful. Then vaginismus. Now, vaginismus is a condition where the muscles of the pelvic floor contract involuntarily during attempts at penetration. Now, this tightening can make the sex extremely painful or even impossible. Women who have vaginismus often describe this as a feeling of being completely blocked during the penetration. And the pain can be both emotional and physical. So we spoke about vaginismus in one of our videos sometime back, so please do watch that too. Then endometriosis. Endometriosis is a condition where the tissue or the lining, which normally lines the inside of the uterus, starts to grow outside this. Now, this lining can attach to other organs such as ovaries and fallopian tubes, leading to bleeding, inflammation, and scarring. Endometriosis typically causes deep pelvic pain during sex, especially with deeper penetration. Then pelvic inflammatory disease. It's also commonly known as PID. Now, this is the infection of the reproductive organs. It could be caused by sexually transmitted infections like chlamydia and gonorrhea. Now, this can cause inflammation and scarring, leading to, once again, deep pain during the intercourse. Then, of course, the fibroids and ovarian cysts. Now, these are the non-cancerous growths of the uterus and ovaries. They can cause pressure or pain during sex. Now, these growths can, especially if they are very big, can distort the normal anatomy of the uterus and ovaries, making intercourse uncomfortable, and especially during deep penetration. Then childbirth and surgery scars. So scarring from the vaginal delivery, particularly if you've had a big episiotomy or a tear, can lead to painful sex. Similarly, scarring from the surgeries like C-section and hysterectomies also can cause discomfort. Very rarely, bowel problems like irritable bowel syndrome, ulcerative colitis, Crohn's disease, bladder problems like chronic UTIs, interstitial cystitis also can make the sex very painful. While physical causes are common, sometimes the emotional and psychological factors are also an important reason of painful sex. The mind and the body are closely connected, and emotional stress can manifest as physical pain. So here are some emotional and psychological causes which can cause painful sex. So first is anxiety and stress. Now, anxiety, especially related to sexual performance or body image, can cause tension in the pelvic muscles, leading to discomfort or pain. Stress about work, relationships, or personal issues can also interfere with the arousal and natural lubrication, making the sex painful. Second, past trauma. Now, women who have experienced sexual trauma, such as abuse or assault, may develop a fear or anxiety around sex, leading to involuntary muscle tightening or pain during intercourse. And this pain can persist even after the trauma has passed. Depression. Now, depression can reduce sexual desire and make the body less responsive to arousal, which can contribute to painful sex. Women who are depressed may also be taking medications which can affect sexual function and lubrication. Very important, relationship issues, tension, or unresolved conflicts in a relationship can manifest as physical discomfort during intimacy. So if emotional connection or trust is lacking, the body may respond with pain during sexual activity. So now, what is to be done? So if you've been experiencing pain during sex, the first thing, the most important thing which you have to do is to visit a gynecologist. The gynecologist should be your first point of contact. Now, many women feel embarrassed or ashamed to bring this up. But remember, painful sex is a medical issue. It is not something to be ashamed of. So now let's talk about what is the treatment for the painful sex. So the right treatment depends obviously on the underlying cause. But there are plenty of ways to address both the physical and the emotional aspects of painful sex. First is lubrication and moisturizers. For women dealing with vaginal dryness, using a water-based lubricant during sex can help reduce friction and discomfort. In case of menopausal dryness, the doctor may prescribe a vaginal moisturizer or low-dose estrogen cream to restore the natural moisture levels of the vagina. Second is pelvic floor physical therapy. Now, in case muscle tension or vaginismus is causing the pain, working with a pelvic floor physical therapist can help. Now, these specialists can teach you exercises to relax and strengthen your pelvic muscles, making the penetration less painful. We also have topical numbing agents. Topical means this can be applied over the skin. So for conditions like vulvodynia, the doctor can prescribe a topical numbing cream or ointment to reduce the sensitivity and pain around the vulva. And they can be applied before sex to reduce the discomfort. And then, of course, we have medications for the underlying condition. So in case your pain is because of a condition like endometriosis or pelvic inflammatory disease, the doctor may recommend medications to treat the underlying issues. So like hormonal treatments, antibiotics, anti-inflammatory drugs can help reduce the pain and improve the sexual function. Then, of course, the cognitive behavioral therapy. It's called CBT. So if emotional factors like anxiety, depression, or trauma are contributing to painful sex, cognitive behavioral therapy by a psychologist or a psychiatric can be an effective treatment for this. Now, this helps you identify and change the negative thought patterns and behaviors which might be causing the pain. Of course, for couples dealing with relationship issues or sexual discomfort, working with a counselor or sex therapist also can be incredibly helpful. They can help you address communication problems, build trust, and explore ways to improve your sexual relationship. And of course, in the last, we have surgeries. So in cases where you have big fibroids, big ovarian cyst, or there is scarring which is causing the pain, surgery may be necessary to remove the growths or repair the damaged tissues inside. Now, this is typically reserved for more severe cases when all other treatments haven't really worked or failed. So, Maitri is a place where we speak the unspoken. Painful sex is one of them. Remember, you don't have to suffer in silence. There are effective treatments available, and speaking with your doctor is the first step towards finding relief. So if you have any questions and want to learn more, feel free to leave a comment below. Do not forget to subscribe to the channel for more content on women's health and wellness. Take care, and I will see you in the next video.